Hi, everybody.
Good morning.
Hello.
Good morning. I just wanted to gather everybody. For those of you who don't know me or haven't met me, I'm Amy Felber. I'm the CFO at WISCAP, out of Westby and La Crosse. I will be helping facilitate roundtables going forward. And since we aren't having a conference anymore in May, I thought we'd just do a quick gathering and kind of discuss some of the things going on with revolving around, sorry, I'm echoing a little bit. Revolving around the COVID-19 crisis going on, some of the things that have happened out of that, policy changes, the CARES Act coming down. And then I also wanted to touch base a little bit on reopening. I know it's not specific to just finance, but kind of what your organizations are doing with regards to reopening. Are you open to the public? Are you going to, when? And some of the things that you're going to put in place before doing so. And then touch base a little bit on the new CSBG dollars that the state of Wisconsin just got and are working on contracts to get out. And kind of wondering just some ideas of what your organizations are going to be doing with those new funds, and if you've come up with any innovative ways to implement new programs for that as well. So that's kind of what I have on my agenda, and then we can always change and make it fluid. And if you have any questions, you know, go ahead and ask. It's definitely going to be more of like a learning discussion. Things are happening quickly, I'm sure, as you guys know as well. I'm pretty sure I'm busier now than I've ever been when we were open to the public. It's just been crazy. Some people you talk to are, depending on what their job is or if they're working from home, you know, they're like, oh no, I have more free time. And I'm like, oh, nope, not me. I'm pretty sure I feel buried, as I'm sure a lot of you do as well. So yeah, so about the COVID-19 stuff going on, WISCAP has been pretty reactive. Hetty Brown is our executive director here at WISCAP, and she's been pretty reactive and proactive as far as fundraising and seeking out foundation monies. We've now spent out since I'd say the last week in March is when we started getting in donations and funds for COVID, people affected by COVID, but we spent out just over $186,000, and that is just for individuals. We've served about 326 households, helping with anything from mortgages, rent payments, utilities, car payments. I mean, pretty much anything. The money that we've raised is from foundation grants and also a lot of just individual donors. There's been a lot of people coming up, stepping up, saying, I want to help. I'm able to help. How can I help? And so we've raised a lot of funds to help individuals. Our food pantries, how many of you operate food pantries yourselves? Or are you, all of you? Yeah, we have 2 food pantries, one in Monroe County and one in Crawford County, and we've seen a huge increase in food pantry clients, and 21% of the clients we've seen in the last 2 months are brand new to our pantries. They've never been to a food pantry. I'm sure you've experienced something similar. We can't keep enough food on our shelves, and it's moving out the door so quickly. We also have started implementing home deliveries to quite a few clients. There's about 200 units that we actually deliver to. They struggle either getting to the food pantry, or they're not well, or, you know, for whatever reason. So we've implemented that as well. And then another thing that we just launched last week is called Launch La Crosse. WISCAP is the fiscal agent for this program, and there's county representatives and our chamber group and downtown Main Street have all joined together to raise money for business clients. So we are helping give out 0% loans and grants. A lot of them are going to be grants to businesses who are also struggling with COVID-19 closures, paying for, whatever it is that they're applying for. So that just launched, and we started raising funds for that as well. So we're trying to hit the individuals that are affected, and as well as the business clients too. So yeah, that's kind of what we're doing as far as new programs related to COVID. We'll talk a little bit about policy changes in a minute, but what are some of the things that your agencies have done with regards to COVID-19 or changes you've made?
Hey, this is Pam, and I apologize. I don't know why my video doesn't work or my sound, so I had to call in.
That's okay,
Pam. I am
Pam.
dressed, just letting you know, I am dressed. I've been working all morning, and I have to second, it's been way harder working from home. Way more work, a lot harder to make other staff understand certain things without being there to show them visually. It's been difficult. We are reopening on Tuesday, but we are, asking clients to wait outside to your appointment, only one person in the waiting room, that kind of thing. So we have tons of rental money we got from community foundations, from St. Joe's Hospital, from some of the United Ways, and it's for rent and utilities, which is honestly really helping people that didn't pay their utilities all winter and normally don't have any place to go, and now they can get it paid. So basically that's what we're doing. And with our new CSBG money, we're buying a lot of things we never had for working remotely. We've kind of piecemealed, like our weatherization auditors have laptops. Well, they haven't been working remotely. They're not working at all right now. So we've given them those laptops to our finance staff and different administration so that they could work remote and log into our server and that kind of thing. So we're using some of our CSBG money to buy those kind of things we need. We need projector screens and projectors for our conference room so we can do video meetings, that kind of thing.
Thanks, Pam.
Yeah.
So you guys are opening to the public this coming Tuesday?
Yep, Tuesday we are.
Have you purchased any new supplies or equipment with regards to protecting your staff, or have you provided face masks, or have you guys made anything, changes like that?
Well, we already have face masks because we have them for our weatherization program anyway. But we're not making any of that mandatory. We're telling people if you want a mask, we have it. It's completely up to you. Everyone has their own office. One thing we did provide hand sanitizer, which we always have anyway, but to every individual office for their desks. And we are having a big glass built actually by one of our glass companies for our front desk because she is exposed. So we're hoping that can get installed on Tuesday, and that way she would be protected. But other than that, there is not really a lot we can do in our office besides, the stuff you normally do, wash your hands and, that kind of thing. The weatherization program is a different animal. They have all kinds of protocols because they have to clean all their equipment before and after every house. We do also have the things where you take the staff's temperatures, and whether we can use that for clients or not, we don't know yet. I have a cap law webinar at 12, so I am going to have to exit off of this one, but I'm hoping that they will answer some of those questions as far as liability and what rights we have if someone's sick to say, I'm sorry, you have to reschedule. I mean, right now we're asking people to, but what if they don't?
Yep, I'm also on that cap law webinar as well. I'm pretty sure I have 3 webinars today. I just got off one at 11. Yeah. I was on one with regard, and I'm sure you guys are going through the same thing, just trying to keep up with all the changes happening. But another thing too that I kind of want to touch on a little bit are the PPP loans. I want to know who else has applied for a PPP loan and gotten one. Have any of you?
No, we didn't need it.
You didn't?
Yes, we did.
We applied, we got it, and we've already returned it.
Returned it, meaning you've already,
We
you
paid it
just didn't
back.
need it?
Well, because the point of it was to maintain staffing and we laid people off. So
Gotcha,
we reduced our FTEs so we couldn't keep it.
gotcha.
Okay.
Hi, Pedro.
Milwaukee Social Development Commission did a PPP loan.
Are you guys intending on spending it out for the purposes of hitting that 75% payroll marker to get it completely forgiven, Patrick?
Yes, we are hoping to do that. We may end up having to pay a little bit of it back if it's going to only be 8 weeks, because their calculation, they did it times 2.5, and there were a few programs that we have to spend down. And then also the weatherization program, we've got fully operational from, most people are working at home, a few at the office. And then we just had a couple little grants that we needed to spend out through April, that those were able to work as well. But it's been a big help for us because we had anywhere from 25 to 30 people who really weren't fully working. So I think for us, it's kind of helped in that regard. I have a feeling we will be paying some of it back unless they lift the restrictions to be more than 8 weeks.
Yeah, so good point. I was just on a webinar regarding the PPP loan and forgiveness, and they discussed that that is up in the air. They are looking at extending that 8-week marker, which would be really helpful for us too. I can't remember what they said, if it was 12 or 16 weeks that they're looking at extending it to. That would be really helpful, because then we for sure could have it all forgiven, which would be nice. One thing that we actually are struggling with is, apart from like you, Laura, we had one person leave voluntarily. So we only applied for a very small PPP loan for our Bargain Boutique thrift store. We operate a thrift store in one of our locations. And so shutting down the thrift store obviously has a huge economic impact for Coulee Cap. We rely on those funds for helping our programs. So we applied for it just for that Bargain Boutique store, which only had 3 people full time. So it was a very small amount of money we applied for. But one of the staff actually left voluntarily. We didn't lay her off mid-April. And so I had to do a lot of research because I was scrambling trying to get this application in all while this was happening. And I was like, oh, how's this going to affect our forgiveness? I still haven't got complete clear guidance, other than I've been told we have until June 30th to restore all employment levels for, you know, levels that had changed up to April 26th or something they had stated. But my question is, and I didn't get it answered with my last webinar I was on, I have another PPP loan webinar later today with Wagner CPA firm, and I hope to get my question answered there. It's more of a Q&A type webinar. But, you know, the 8-week period for me will end June, I think, like 22nd, because it was dependent upon when you got your loan proceeds. Well, we aren't going to have that person restored, that position restored, until about mid-June or so. So how is that going to affect us getting our loan forgiven? I'm not going to have her wage to report as an expense. So I am a little bit nervous about that. You know, we could definitely be giving back some of our loan too, Laura, based on that. I mean, the guidance was, they said you have until June 30th to restore that position, but how does that affect, you know, us reporting our expenses correctly? So that could definitely cause an issue for us, which is unfortunate. But yeah, as far as policy changes, we implemented a pretty quick policy change and had our board approve it within our personnel policies. We really did it specifically for our weatherization staff. I was on quite a few calls with DOE in the state regarding being able to use grant funds to pay the crew members when they're not actually doing weatherization services. And the state actually was pretty flexible. I don't know how many of you sat on some of those phone calls, but they were pretty flexible as far as using program support dollars instead of the direct labor budget category. And so our HR manager pretty much whipped a whole bunch of trainings up. They did I can't remember how many hours of trainings our crew members did over the last month and a half. They did some miscellaneous weatherization, you know, filing, scanning, some other support things that they helped out with. And we pretty much have been able to make it work and still pay for them out of the grant, which has been great.
Amy,
but yeah.
Amy, that's part of why we also sent it back, because part of why we applied for the PPP was that was right at the same time that the state was looking at weatherization. And we were looking at, you know, if we had to shut down but still keep and retain employees. And then the state for the weatherization contract became very flexible, and being able that we could use program support dollars instead of the direct labor. Then all of the time that we've been able to charge to the grants. And so then that also meant that the PPP loan became less necessary.
That completely makes sense. I assume you took advantage of asking for more program support dollars. Yeah. Yep, we did too. So that was really helpful. Patrick, I'm curious, question for you regarding the PPP loan. I didn't get clear guidance on whether or not, how it would work using PPP proceeds for grant funded program staff. I tried to kind of figure out, if we get federal dollars from a grant, what do you have to show, Patrick, to show that you're affected by that funding source in order to still use PPP loan proceeds? Or, because you said you were using it for grant funded people too as well, didn't you?
Yeah, so what I've seen right now is there really isn't a lot of clear guidance out there. As far as the SBA's, I mean, they put out their application. They quickly got it out, I think, last Friday, but there really hasn't been any follow-up as far as frequently asked questions or anything that I've seen. The one thing that we have done is all staff that weren't working, we created a separate payroll code. So we called it payroll-COVID-19-regular. So that I could differentiate who was actually working from those who weren't working. And then because they are changing all their guidelines, it seems like on a weekly basis. I mean, we got ours out 4 or 5 weeks ago, and even since then they've changed their guidance. Because I know somebody had a question as to whether you're doing cash or accrual basis, and they almost seem to be mixing their bases with the latest guidance that I saw, because they said if at the beginning you paid a utility bill, you could count the whole thing. And then if at the end you still had money left over, you could accrue a utility bill. So I guess at this point, that's half the battle with this PPP loan, is they haven't sent out any clear guidance. And it really makes no sense if you're, you know, with your normal accounting systems.
Yep, I agree. The webinar I just sat in too, they kind of gave some conflicting information, and it made it appear that the guidance has not been super clear. So I guess at this point, we just kind of wait and see, and work with your lender too, right? They're the ones that have to collect all the documentation. And really, in essence, they're the ones making the determination as to whether or not you get that forgiven. So yeah, I'm in the same boat. I have some of those same questions, but there has not really been clear guidance as far as what they're going to need for documentation for using it for grant funded staff. Because I debated applying for funds for that purpose, and I was like, oh, I'm just going to steer clear of it. Weatherization pulled through for us, so I was like, not going to go down that road. And we just applied for our bargain boutique, and then we had a staff person leave. So, so yeah, I guess we'll have to just kind of wait and see how that goes. But the only actual policy change we made was to add a little blurb in our, with regards to leave for our staff and sorry for the background noise, my children are here. I'm asking them to leave. But with regards to the policy changes, we've implemented an emergency closure, which really we had a hazardous weather pay already. So we just did a little add-on that in the event of something like this for emergency closure, that we actually would allow from a organizational standpoint to pay out leave. We wanted to make sure that that was written in our policies, so that way when weatherization says you can continue paying them even though they're not doing their normal job duties, that we were kind of covered in that regard. We did not add anything for the CARES sick and CARES FMLA that have come down in the CARES Act that you can get government credit for. Did any of you add anything like that to your policies or do a temporary addendum?
We did.
You did?
Yeah, we didn't, so far we haven't had to go into the FMLA, only the emergency sick leave.
Okay.
We've had
did as
people,
well.
yeah, we've had
Did you
people
actually
using
get-
both.
You did.
And we've been
Did
getting the
you-
credit.
Okay, did you actually add that into your personnel policies as a permanent change, or did you do it as a temporary change?
They used more nebulous wording, a little more broad, saying as we need to implement, you know, leave policies, we'll follow any state and federal, blah, blah, blah.
Yeah, so didn't put it specific so you can use it going forward?
Right,
Mhm.
right.
Yep.
And so then obviously any pay for that is not charged to the grant. So we created a separate silo, a separate grant fund for that kind of pay, so that we don't, so that, you know, there's no double dipping. It's kept separate because then the tax credit wipes that out.
Yep, we did it the same way.
So you guys are actually recording the expenses for that in a separate fund?
Correct, and then you get credit when you do your quarterly tax report. For those
Do
days.
any of you use, do
We've
any
been
of you
getting the
use,
credit, we've been getting the credit through, well, we use the payroll service. And so we've been getting the credit every pay period.
Okay.
two?
Ours is small, so we're just waiting till everybody uses up their 80 that they were entitled to, and then we're gonna claim it all in one quarter, so.
Yep. We get ours too, Laura. We use ADP for a processing, for a payroll, and it's kind of the code that they have through ADP will automatically just deduct that amount right off the payroll that they take out of our account. So, I mean, it kind of works pretty slick. I did not set up a separate fund. We just make sure that we've reduced our expense in that grant for the credit to kind of do a net effect in the grant. But now that I think about it, I might want to move it out to a new fund just so it doesn't get, you know, sticky.
Mm-hmm.
Mm-hmm.
Right.
In,
It's a good idea.
this is kind of off topic, but we've been very unhappy with our payroll service and how they implemented all this. So I am open to hearing about what payroll services people use and if they've been handling this well.
Well, I'm happy with the way that they've handled this particular circumstance, but I would not sell them to you in any other regard.
Okay.
We have been super happy with ADP either. The customer service and getting passed around to different reps has been not good. We've not had one consistent rep that we could go to for questions, and we've been told different things by different people. So I have not had a great experience with them thus far in the past 2 years. We've also looked at switching our payroll provider too.
Okay. Right now we're using Paylocity. We had been using Paychecks before until we encountered that they had set up a post-tax deduction as a pre-tax deduction, and we had to file corrected tax returns for 5 years.
Oh my.
Yeah, that was not a happy time. So I wouldn't ever go back to Paychecks. And in the past, quite some time ago, I had poor experience with ADP. But I was ready to consider that maybe they've improved, but it sounds like not.
It hasn't been great. No.
We use Paychecks, and we also are looking at changing softwares. We were looking at Paylocity, or considering it. So I'd be real interested in hearing, you know, what everybody uses as well. Paychecks for us doesn't handle the auto labor distribution part of things well, so it doesn't distribute the health and the employer cost of those benefits appropriately. And especially if we move to the Flex version, right now we just use the Paychecks HR Online version. So we've already heard that if we move to Flex, that it gets even worse. But we want electronic timesheets. We're just looking, when we make the move, we want to make sure that it's going to do what we need it to do. So.
Well, at first we were very pleased with Paylocity, but when I'm looking now for online payroll services, their name doesn't even come up.
Oh, wow.
And so we've been with them for a few years now, and so clearly they have dropped out of the lists of companies that can handle it.
So I can speak to this topic as we changed payroll companies at the beginning of 2019. I will say that it's really hectic changing payroll companies right at the end of a fiscal year, having new grants open, and I'd probably, if I was to do it again, do it in like July or April or August. But we made it through. I will say our new one, Neon HCM, which you probably have never heard of, because I had never heard of it until we had employee benefits brokers who kind of had a little bit of a thing that they would help people switch payroll companies. So they put together, we looked at, I believe it was 5 different ones. One of them was Paylocity, Neon HCM. There was even worse ones. Like, I'll just be real honest. We switched from Paychecks and they could not handle grants. Like, we have so many grants and they could not allocate salaried people's hours properly. And it just drove me insane. So I feel anybody's pain that's with Paychecks. We've been pretty happy with Neon HCM. I will say we probably need to utilize it better, because as I stated, when we rolled over to them, we had a lot of different things going on, and I'm actually down a grant accountant right now. So it's been a little hectic trying to keep everything rocking and rolling. But that is one of my items by the end of the year, because they do have a function where I could drop all my payroll entries into our accounting system. I'm just not utilizing it at this moment. But as far as time card and all that, it is very easy. We are about ready to go to their performance management system, which I don't know if the rest of you guys use paper, but it's a brutal process when you got to do your evaluations through paper. And I know our HR team is like,
too?
timesheets are electronic. We're actually, I'm gonna see if we can do, right now we only do 2 sign-offs. I wanna actually get a 3rd one, because what I've noticed is when you just have the employee and the supervisor sign off, the projects aren't always correct, so that we're making more corrections on the accounting side, just because the program managers don't always realize what's going on the accounting end. So I'll probably be putting what we call our grant accountants, who take care of all the grants, and then also our administrative departments. But we've been really happy with them. I will say we had a slight hiccup on the first payroll of COVID-19, as they didn't quite do because we also do a 403B. They hadn't quite done that properly, but ever since then, we've been running payrolls and it's been pretty slick.
What's the name of that company again?
It's Neon HCM, and I can send out their information to the group if others would like that.
That would be great. It sounds like that's a need, Patrick. And that gives us another company to kind of look at. So that would be really great.
And
Yes,
just
thank
so
you.
everybody's aware, they are based out of Tennessee with offices also in California. So most of what we did was through online trainings with them. But they've been really helpful over the phone. You get one rep, and if that rep isn't available, there's actually usually 1 or 2 backups. So within 30 to 45 minutes, your question is answered. Whereas I know with Paychecks, I had to sit on the phone for like 2 hours because we never had a consistent rep. And with Paychecks, all of their things are separate. So their time cards were separate from their payroll reports. And it was just awful for us.
This is
Good.
Kathy from NewCap.
Okay.
We've been going through the payroll implementation. We had used IOI. I don't know if any of you guys have heard that because we use Black Fraud, and that's who they were working with. Then they got bought out by PrimePay, and then we had decided maybe we were going to go with Paycor. Do not use Paycor. We had nothing but headaches from their customer service to handling our GL. So then we went back to PrimePay, who had bought out IOI, and very happy with them. We have one person, and I can call him if we have any problems, and we haven't since we've gone back to them. They handle, all the project codes. They have somebody that worked on our GL. They had never seen anything with all the different project codes that we have for our different grants. And we got a little drop down. It's all online. They use time and attendance. Little drop down for whatever payroll code, because we've got some people that might be spread against 15 payroll codes. So they've been really, really good. And like I said, my biggest thing with Paycor when we started talking to them is they didn't have very good customer service, and they could not even handle our GL. It was very difficult process. So if anybody is interested, PrimePay has been very good.
Kathy, do you mind sending that company out to the group as well?
Sure, I can do that.
That'd be great.
The original, like when IOI, they did, oh, sorry, my dog's barking at the mail person. They did, Dixie, stop. Brian, IOI was out of Indiana, and so they've even though they got bought out, they remained with PrimePay, and so we have the same rep and we have the same trainer. His name is Rodney, and I said, like I said, if there's any issues, he is like on it within, an hour. He'll watch your payroll, make sure everything, is going correctly and stuff. Whereas like some of you have said, when we tried Paycor, they were like, we have to get this person, and then we'd have to call the hotline, and they really had a very bad customer service. So, and I know they're really making a push in the state of Wisconsin, but yeah, didn't have a good experience for them. But I will put out for PrimePay for you guys.
Actually, Kathy, why don't you and Patrick send those 2 companies to me, and I can send them out to the group, and that way we don't have a million emails kind of going out. Are you guys okay with that?
Yep.
Okay.
Yep. Sounds good.
Yep, so go ahead and just send them to me. You should have an email from me not too long ago that you can find my email. Otherwise, I can give it to you at the end.
Yep, I have it.
Okay. Any other policy changes that you guys made to your actual policies with regards to COVID?
Well, we have a communities, I don't know if you guys have any community health services. We have, like 5 clinics. And so we've had to do a lot of, they're only open, they've been seeing clients through this whole thing. They're open 3 days a week. And of course, they have to do the temperature for anybody coming into the building. And they have to wear their PPE equipment or PPE protective equipment, which is a face mask, and they have to wear gloves. So, and I know that we're not opening until the 15th of June is what we're looking at. And that even when we go back in the offices, people are going to have to still wear their face mask unless they have their door closed and they're in their office themselves, and gloves.
That's exactly what we're implementing, Kathy, and we're shooting for June 22nd to reopen to the public. And one of the main reasons for that is we are ordering actual hand sanitizing stations, and they're not coming until mid-June, and we want to have those at our 4 locations for even when clients come in. We want to make sure that everyone has access to hand sanitizer right when they come in the door. And we also will be requiring our clients, in the short term anyways, to also wear masks as well as our staff. So it should be very interesting as far as reopening. Are you guys doing anything? Well, you already kind of talked about taking temps, and is anyone requiring, I'm just curious because I've heard this in some agencies, requiring actual testing, COVID-19 testing, if they've had any symptoms? Are you requiring them to take a test?
No, we're not.
I know we talked about it, but I don't know if our leadership staff's talked about it, but it's still in the talking stage. And we could do that easy enough because we have the community health services and the clinics, so it's pretty easy for us to implement that.
How about any changes to your travel policies? Are you right now allowing anyone out of the area, out of the state? What's your travel guideline?
We implemented no travel, like that was back in March still. And that if you traveled outside the area or like did any kind of visiting or anything like that, that you would be voluntarily saying you were going to quarantine for 2 weeks.
Yeah. Same as
And that is still in effect. And
Is
we
that
just
pretty
got,
similar to other? Yep.
We did no travel as well.
Yep, same here. We pretty much said no travel out of our 4-county area. And if you do, then yep, self-quarantine for 2 weeks. We are going to keep that in place for now. Apart from a couple of staff that we have that live outside of our 4-county area, obviously we're not going to make them quarantine every time they come from home. But so we made an exception for that. But yeah, we're going to keep that in place as well. And then the last thing that I wanted to touch on was the CSBG funds. That's exciting, right? I'm sure you all are very excited. It's not too often that you get money and you're like, yay, how can I spend this? Usually you're trying to make budget every year.
Right.
So I know we're very excited. And it happens to be more than our normal allocation, which is pretty cool. We have a lot of ideas. We've met as a management team now 2 times and once via email to go over how we want to allocate and spend this money in the best way possible. Some of the new ideas, and again, I know this is kind of program related, but I get excited about stuff like that. I'm probably an anomaly when it comes to finance staff, but one of the new programs we're kind of looking at is hiring 1 or 2 outreach specialists to actually help coordinate services among all of the nonprofits and services in our 4-county areas, as well as connecting them to services within WISCAP. I think it'll help greatly with referrals. They're going to be like the go-to people and be able to connect them, kind of like a United Way 211, but more intense. Like they're going to be helping these clients get connected. We obviously are talking about how do you sustain that going forward. I know some agencies actually have outreach specialists already, and they kind of just spread their time across multiple grants that they're helping. We don't have that right now. So that's kind of exciting new program that we're going to be implementing. We also are doing a little bit of infrastructure improvement, not too much. I know Anna kind of gave guidance that she didn't want a lot of the new CSBG dollars to go towards just building your infrastructure. She actually kind of told us that if you want to do like software upgrades or things like that, try to use your regular CSBG allocation and really free up this CSBG supplements for COVID-19, if you can really tie it directly back to how it's going to be helping COVID-19 spread and things like that. So yeah, so that's kind of what we're doing. Do you guys have any fun or innovative things that you're excited about in your organization?
we're working on expanding our senior boxes, the CSFP, and the produce that they get and we're working on adding additional senior facilities to our clients.
When you say senior boxes, what are you talking about, Laura? That's new to me.
Well, so we already have the CSFP, which is monthly food boxes to senior citizens. And there's some that get delivered to various facilities, and then there's also ones that come here and pick them up. And so basically expanding that because there's so much more need during this time.
Yep.
So we're trying to add senior facilities to that, where we could take truckloads of boxes to the people there who can't necessarily come, and increase the number of people using it.
Nice.
We've done a
Very
lot
cool.
of increasing in housing, especially now with Governor Evers giving more money for that. So we do a lot in housing, like for youth, individual, domestic abuse. And I think the director is writing like 5 or 6 more grants. So we're doing a lot with the housing.
Very cool.
We are too at WISCAP. I would say we were disappointed at the income requirements, that they didn't change those to be a little different, because we could have helped a lot more people. But I'm sure we'll be able to find uses for it, but we just had to change what our original intent was a little bit. So we were going to do some mortgage assistance or different things like that, but most of the people that might need that probably don't meet the income guidelines. So
yeah, at least they are being a little more flexible on how to calculate income, which is nice, and the timeline that you can draw that from. So that helps a little bit, but you're right. We were pretty excited when we first heard that increase and who we could help to, and then it got shut down pretty quick.
I just wanted to share a couple changes at WISCAP.
Yeah.
Cassidy, I don't know how many of you know this already. She's getting a title change and a slight change in her job description, and she's going to become our communications and outreach manager.
Oh.
And then the office administration functions that she's had will be going away, and we're hiring a new administrative specialist to do those. So that's where some of our CSBG funding's going to be going to. And also, as an aside, not necessarily related to CSBG, we're also hiring for 2 program manager positions. One's a housing policy and programs, and the other is a income and work support program manager. That person's going to be taking over JBD and RBDG from Jonathan. And then trying to increase some of our funding in those areas, trying to get some additional skills funding through the additional funding for JBD that we've been working on for years. And then the housing manager is going to be working with this new RAP program, the Rent Assistance Program, and then try to increase some of our, some work in other housing areas. So those are some changes that are going on. And then in addition, with our CSBG funding, ours is sounds like it's a little different than what Amy described with what Anna had told agencies. We're actually trying to improve our infrastructure so that we can provide more technical support and do some more online training and things like that for agencies, as well as increase our internal infrastructure. I told our board of directors up until 2 or 3 weeks ago, we didn't even have a Zoom subscription. So Cassidy's going to be working on trying to increase some of our capacities there. An additional item that member agencies have talked about for the last few years has been a portal on our website that member agencies can use and staff and go right in there, where we can share partnership information, cap law information, NASCASP information, whatever's pertinent to the member agencies, so they can just access the portal rather than trying to find information from multiple different sources. So those are some of the things that we're going to be working on to try to improve our capacity and our infrastructure to be able to help all the member agencies better.
Nice. Thanks, Diana.
When this all started, we our IT guy got us onto Teams, Microsoft Teams.
You have that too.
because we could get that free through the TechSoup. And so that's a more secure platform. So we're focusing on the Teams and doing video meetings that way. And that's what enabled us to do our board committee meetings and our board meetings in this last couple months, is to get people onto Teams.
How do you like that, Laura? Does it work out well?
It works really well. Yeah. It's
Yeah.
not quite as easy as Zoom. Zoom is a little easier, a little smoother as far as users. The Teams has taken a little bit of work with, especially with some of our board members who are not as tech savvy. But it does work really well. One really nice thing is then it records it. You tell it to record, and so you don't have to take minutes. It's right there.
We're using a Microsoft Team too, and then we also use SharePoint. And so we've been able to find different ways of sharing material when we have the two, both of those that have been actually very essential with this time off that we've had with people working at home. I really like Microsoft Teams. I didn't work a lot with Zoom, but I would definitely, Microsoft Teams has been very beneficial to us.
Nice. We'll have to look into that. Right now, we're just using Skype for Business, and it works, but it sounds like it doesn't have the same functionality as Teams. So
yeah, Teams can be where you can share a file. You can share your screen, obviously, but you can, like you can put files out there, and then anytime I can go out there and look. You have chat boxes so that you can chat with each other, just like emailing, but you're chatting on that. And then we also have like I have a finance huddle set up, and that's how I talk to my staff. We do our leadership meetings twice a week with it. It's, like I said, we've really liked it a lot and have been using it quite a bit and learning things every day that it can do.
Right. This whole last few months has been learning new technology. I was able to use Teams for training for some staff, where normally I would have been in the same room with them, and I was able to get everybody connected on Teams, and then I could share my screen to show the PowerPoint and everything. I haven't used Skype for Business all that much, so I don't know exactly how far that can go, but that worked really well.
yep, nice.
It's
Good.
really good. It's really meant for and really good for smaller groups. Like our roundtables would be okay, but anything larger, Zoom would be more appropriate. So that is one thing to keep in mind, is like how big your audience is. But when it comes to small groups and the necessity for it to be secure, we also use Teams. So, or we've all signed up for it.
We've noticed that too. We use the Teams for smaller. Otherwise, we have GoToMeeting. We use that for our bigger, like our board meetings and things. But
Well, we've had as many, like our board meeting, we had probably over 20 people on. So I don't know how big of a group you're saying when you say smaller versus big.
Yeah, for me, I'm thinking like that would be small for me.
Okay.
I have a skewed version of events because that's what I do. But I'm talking like over 50 probably.
Oh, right.
I
Okay.
use different streaming, like Zoom's still really good. I've sat on several association meetings for anything over 50 because you can force breakouts and that kind of stuff. So yeah, I do have a skewed perception on that.
Cassidy and Diana, since we have you on the line, as of now, I assume the conference is still set to the end of July, or have you guys tossed around delaying that further?
We have talked. We have, that's as much as I know. It's currently scheduled for the end of July. Right now, I'm keeping an eye on our contract deadlines, quite frankly, because the situation is that there are no other open dates this year with that venue. And it is a contract, obviously, so we are financially obligated to pay it out at this point. And so there's a deadline sometime in June, which would, increase that. So I think at this point, Brad's just keeping an eye on that, and we're just going with what we know at that given time. It's not as easy because several trainers have said, well, we'll be on a travel hold till the end of the year. We can't come. So our agenda will definitely have changed. So we kind of keep going back and forth, and we're just gonna, I'm just looking at Brad basically for him to make the decision, and we'll have more details hopefully next month in the middle of the month.
Good, I figure. It's kind of things change constantly, so.
Yeah, well, and like our Poverty Matters, I think it also depends on the county that the event is being held in at this point, because Poverty Matters is in Dane County, and I was reading the Dane County outlines currently, and I think it's like in their plan, they are planning to reduce or, you know, ban any events over 250 until like a vaccine is approved. So like, who knows when that is? It's certainly not gonna be September. So, and then like, so I don't, yeah, that's as much detail as I have.
Okay, fair enough. But I think that is all I have for today. Does anyone else have any comments or questions for the group? No?
I will say I recorded this and then I just upload it to our YouTube channel. And it's usually ready in about half an hour, so I'll send it over to you, Amy, and then you can just put it with that other email that other people are sharing information with. So
Perfect. That sounds great. I appreciate everyone's time. Thanks for joining.
Thank you.
Thanks for setting this up.
Yeah. Have a good day.
Thanks, everybody.